Hi, I'm Dr. Brian Ng, and I'm a clinical assistant professor in the Department of Family Practice at the University of British Columbia. And today we're going to talk about interpreting the evidence. So the objectives for today, we're going to try to gain proficiency in searching for systematic reviews. We'll review the differences between narrative and systematic reviews. And we'll learn the elements of a written literature review for a research proposal and paper. Here's a comic about a Cochrane review. So we'll start with a clinical scenario. Mr. Sandhu is a 28-year-old teacher who comes in with typical upper respiratory tract infection symptoms. So he's coughing, he has a runny nose, and a scratchy throat for a few days. He's otherwise healthy and not on any medication and has no allergies. You diagnose an upper respiratory tract infection and tell him it's likely a cold that will improve with time. He asks if zinc will help, as he recently heard from a friend that it will. You're not sure about this, so you decide to do a quick search of the literature. So here's an example of a search that you might want to do on Ovid Medline. So we can start first with searching for a common cold. That yields 3,383 results. We can limit the first one to review articles because we're short of time and we don't want to take a long time looking at multiple randomized trials. And we'll also search for zinc and do the same thing. And we'll combine the review articles searched for under zinc and common cold, and we come up with 28 articles. So you look through the results and find this article that seems to answer your question. So this is a systematic review. So what are systematic reviews? Well, as you probably know, there are 4 different types of evidence-based medicine articles. So there are articles focusing on diagnosis, which look at sensitivity, specificity, positive and negative predictive values. Harm, so these are typically cohort studies or case control studies. Therapy, looking at whether a therapy works or not, and so this is typically randomized controlled trials. And prognosis, and these articles are typically found in, for example, the cancer literature, and they tend to be cohort studies. However, none of these types of articles focuses on summarizing the evidence. So what are systematic reviews? Well, because there's so many studies out there that address many clinical questions, review articles serve an important role in summarizing the evidence. Just like how it is important to protect against bias and random error in conducting primary studies, it's also important to use rigorous methods in summarizing results of studies. So systematic reviews tend to use a systematic method to search for studies, but publication bias can often exist, and this is when negative studies tend not to be published. This has been mitigated somewhat with the trial registries, and so therefore, when conducting a systematic review, it is important to also search the trial registries. So as an example, what is enough for you to accept a new therapy? So what is enough for you to tell patients that something can be harmful? Is 1 RCT enough, or 1 cohort study? Or how about 10 RCTs of 10,000 participants each? What about adverse effects? How do we determine whether a drug or a therapy causes certain adverse effects? And do we have the full picture with only 1 RCT? In answering this question, we can look at the Bradford-Hill criteria. These criteria look at causation. So we look at, for example, the strength of the association, how large is the effect, the consistency of the association. So this would be answered best with a systematic review. So, for example, if multiple studies have been observed but have shown the same association in different populations using different methods. Specificity, does altering only the cause alter the effect? Although this is a weak criteria. Temporal relationship, so does the cause precede the effect? Biological gradient. Is there a dose response? Biological plausibility. Does it make sense that it will work biologically? Coherence. Does the evidence fit with what is known regarding the natural history and biology of the outcome? And experimental evidence. Are there any clinical studies supporting the association, especially randomized controlled trials, although sometimes randomized controlled trials are not available due to ethical reasons? Reasoning by analogy. Is the observed association supported by other similar associations? So this is a hierarchy of evidence taken from a diagram out of Dartmouth and Yale University. At the very top of the hierarchy of evidence is systematic reviews. Following that are critically appraised topics, so these are evidence syntheses, and critically appraised individual articles, so these are article synopses. These are what we call so-called filtered information. Unfiltered information tends to be primary studies like RCTs, cohort studies, and case-controlled studies. And the weakest level of evidence, of course, is expert opinion or simply background information. We're going to switch gears a little bit and talk about narrative versus systematic reviews. So narrative reviews are often found in many textbooks and journals. They typically discuss disease etiology, diagnosis, prognosis, management, and address many interesting questions. You may find it helpful to obtain background information for a particular condition and common treatment methods, and indeed narrative reviews are adequate for this purpose most of the time. However, authors of narrative reviews make no attempt to be systematic. They don't present a rigorous, reproducible search method, and they also don't report a clinical question and don't list or rigorously examine primary articles. So here's a summary looking at the differences between narrative and systematic reviews. So looking at the clinical question, systematic reviews tends to have a focused PICO question, so specifying the population, intervention, or exposure, and outcome. Whereas a narrative review seldom reports this or addresses several general questions at once. In the search for primary articles in the narrative review, this is seldom, if ever, reported. Whereas in a systematic review, there is a comprehensive search of several evidence sources, and this is reported so that it can be reproduced. In the selection of primary articles in narrative reviews, this is again seldom reported, and if reported, it's often a biased sample of studies. In a systematic review, there is explicit inclusion and exclusion criteria for primary studies. In a narrative review for evaluation of quality of primary articles, this is seldomly reported, and if reported, it's not usually very systematic. In a systematic review, the methodologic quality of primary articles is assessed using a rigorous systematic method. And in the summary of results in the narrative review, there's usually a qualitative non-systematic summary, whereas in a systematic review, the synthesis is systematic, and it can be either qualitative or quantitative. Meta-analyses. So a meta-analysis is typically done on a collection of randomized controlled trials. Quantitative methods are used to summarize the results of all the RCTs included. So typically, software used to write systematic reviews, for example, RevMan used in writing Cochrane reviews, have built-in statistical packages to help with the analysis. A meta-analysis may or may not be a systematic review, but they usually are. And you can pull several RCTs together to do a meta-analysis, but authors may not have done a thorough systematic search. So don't use the two terms interchangeably. So in looking at a systematic review, there are 8 questions that one should ask. So did the review article address a focused question? And typically this is a PICO type question. Is it likely that important relevant studies were missed? So ensure that all adequate and relevant databases were searched. Were the inclusion criteria used to select articles appropriate? Was the validity of the included articles assessed? And were the assessment of studies reproducible? Were the results similar from study to study? This is something called homogeneity and can be measured quantitatively. What are the overall results and how precise are they? So are the results all over the place, or do they focus in on one point? And finally, will the results help in caring for patients, which is the question we all want to know. The process in writing a systematic review is often lengthy. The first step is to define the question, as in most research studies. So we look at PICO, so the population, intervention, comparator, and outcome. You then would conduct a literature search using appropriate terms, and this will include searching databases like Ovid, like Medline through Ovid, Embase, and any other databases that are relevant. You can talk to experts, funding agencies, pharmaceutical companies, do hand searching, looking at personal files, trial registries, Cochrane, and the citation lists of retrieved articles. You apply the inclusion and exclusion criteria that you came up with beforehand, abstract the data into usually a spreadsheet, and conduct analysis. Literature reviews. In general, most of you won't be doing a systematic or even a narrative review for your projects. If you're writing up a manuscript for your research study, however, all of you will be required to do a literature review. So what components are necessary in such a review? In general, when you write a manuscript, your literature review should encompass the following 5 points. So identifying any areas of prior research to prevent any duplication. So has my research question already been answered? Placing your own original work in the context of existing literature. Describing the relation of each work to the others under consideration. Identifying new ways to interpret and shed light on gaps in previous research. So for example, if research studies have been done to answer your particular question, but not in your country, for instance, this might be a way for you to add new knowledge to the literature. Resolves conflicts among seemingly contradictory previous studies. So these points should be woven through your introduction and discussion sections, but should be a standalone section in your proposal. In an annotated bibliography, you might want to do an annotated bibliography to help you conduct a literature review. Such a bibliography consists of your citations, a brief summary of the citations, and your critical assessment of them. This generally is not a part of your final write-up per se, but is simply an exercise to help you write your literature review into your final manuscript. Here's a link on how to write an annotated bibliography with some examples. So, in general, when you write your literature review in your manuscript, you want to start with general worldwide studies and then move to more focused studies specifically related to your research question. All relevant literature cited in your literature review should be correctly formatted and listed in the bibliography and references sections. It is not important what specific style you use to cite your literature, but it's important to be consistent, and depending on the journal to which you submit, this can vary. So in summary, systematic reviews use a systematic, rigorous search method to identify all possible articles about a topic. Meta-analyses are quantitative summaries of the literature. They are systematic reviews, but not all systematic reviews are meta-analyses. Be aware of publication bias. And although not all of you will conduct a systematic review, you will conduct a general literature review when writing your manuscript.